దాంట్లో దాంట్లో యాడ్ చేసిన ఇప్పుడు అది లాగౌట్ ఎట్లా అవుతుందో తెలియట్లేదు. ఏంటంటే త్రూ ఆల్ అకౌంట్స్ అంటుంది, అంటే అన్ని అకౌంట్స్ లాగ్ అవ్వాలి. మళ్ళీ నేను అన్ని నా మెయిల్స్ అన్ని లాగిన్ అవ్వాలి. ఉమ్. వీడియో కెమెరా రాదు. Hello, good afternoon. I'm Dr. Rajasekkhar pappu. Today we are going to talk about common mistakes in diabetic foot management. So most of the times we can consider them as patient negligence, and also sometimes when you go to a doctor, sometimes maybe they might not be treating in the diabetic foot, and most of the time they don't know understand many people don't understand the biomechanics of foot, and then what is leading to ulcer and why it is not healing. So these things needs to be assessed and checked whenever we see a diabetic foot. So most of the times the ulcers in the foot are main reason for complications like infection, and then leading to this infection leads to amputation. The most common mistakes done by a patient is barefoot walking and inappropriate footwear. So whenever they walk barefoot. So these people will have diabetic neuropathy. Because of that, they will be lacking sensation. They don't know properly to assess hot and cold. So if it is summer and if they walk barefoot on any warm or hot road, or any tile floor at home. Suppose if the tile floor is exposed in the veranda of the house or in the garden of the house, they have some tiles or stones, flooring is there. If they are walking on it and if they have any heat burns, they will lead to the injury of the foot, and these burns might become ulcers. So barefoot they should never walk. And also sometimes even indoor they walk sometimes without footwear. So the diabetic patients always must use two pairs of chappal, because in Indian culture we don't allow outside chappal to wear inside. So they must have two, three pairs of diabetic footwear. One for the outside use, one for the washroom, one for the in-house wearing. So indoor when they are walking, what happens? They don't use properly these footwear. So sometimes if they get injured, maybe some pins or some objects might penetrate their foot. So here, what happens? They will not have sensation of the pain. They don't know that they have a injury there, so they keep walking. And with the open ulcer, this open ulcer will lead to the formation of formation and growth of bacteria into that. So the dust will penetrate into these ulcers because they don't know that they have ulcers. So to avoid this, every day you have to inspect your foot, see whether you have any ulcers. If there are any ulcers, you have to clean them properly. Foot ulcers. So if these ulcers are not healing, you have to approach a doctor, specialized doctor in diabetic foot care, so that they will assess your foot and the reasons behind your ulcer. And also, these ulcers won't heal because they will be having some vascular problem. So we must be very careful. So almost all of these diabetic patients will have diabetic neuropathy, and then also vasculopathy. So they will have vascular problems, vascularity problems. So always their limb foot is in ischemia. So these turns out to be a chronic non-healing ulcers and then lead to infection, amputation. So they have to do daily neglect. If they neglect, they should not neglect daily inspection. So failing to check for cuts, blisters, red spots, swelling daily allows minor issues to progress rapidly. So whenever they miss to check their foot for any cuts or blisters or any redness of the area, so any problem in diabetic foot we starts with redness. So there will be some superficial infection, and then slowly the skin gets denuded, and then ulcer starts. Another problem what most of the diabetic foot patients do is that they start self-treating the foot issues. So using medicated pads, razor blades. So they use sharp objects to clean their calluses and corns with contaminated instruments. So that will lead to the insemination of bacteria and infection. So this will lead to again increased infection because most of them have vascularity. I'm telling you vascularity problem because I'm telling this because most of the diabetics foods lands in amputation because of these vascularity issues. So sometimes they know that they had an injury. Many people come that they had some just a small cut. They neglected it and then they have not taken any care. And that cut wounds become a major issue in future because if you are not taking proper cleaning of the wound dressing, and then if you are not using any medicated dressings or sterile pads, slowly that wound gets infected and infection starts spreading along the foot. So that leads to again sepsis and all complications and improper hygiene and care. So whenever you have that the skin is dry, you have to moisturize it properly. You have to soak the foot inside warm water and then clean it with pumice. You should not have any of those foot cracks and all that. Fungal infections mainly you should avoid using your foot in wet areas where that gets soaked and you develop fungal infection. That cracks and all that should be cleaned properly with antifungal creams, with pumic stone and all. So if you don't take proper hygiene of your food, that gets infected. Neglecting professional advice is another reason why there complications happen. Most of the times they don't go to a professional doctor where they want to get it treated. So they go to somebody unprofessional in villages. They go to areas where doctors are not there. Not everybody, every corner has a diabetic foot specialist in India. So they do go to some practitioners who are not even doctors. So they will treat them without knowing what might happen to these patients, and they land in ulcers which require expert management and failing to get into these advices and following those advices lead to the amputation. So in the beginning only we talked about that heat exposure because of the summer or some other reasons. They don't know the objective whether it is floor is cold or hot, so they must be very careful while walking. So what are the main diabetic foot deformities? What happens is swan neck deformity, hammer toe, hallux valgus, crossover toes, metatarsal drop, and equinus. So equinus deformity. These are the main common deformities in all these diabetic foots. So these are the first basis for any complication to happen in any diabetic foot patient. So if there is a swan neck deformity, they will have toe tip ulceration because the foot is always like this, and then they will have metatarsal base also, the head also, they will have ulcer over the in hammer toe, they will have ulcer over the tip of the toe. Hallux valgus, what happens? Their toe gets crossover like this, and then the second toe goes into the hammer toe, goes into swan neck deformity, and this causes ulcer over the PIP joint of the second toe, and also if this hallux valgus deformity is associated with a flat foot, they will have ulcer over the medial side of the head of the first metatarsal. So most of the people will have diabetic metatarsal drop, and that leads to ulcers. So we must be very careful. Callus formation, equinus deformity. Most of the patients who have taken treatment, they don't give proper importance to maintaining the ROM of the joints. So you have to maintain the joints of all joints of the foot and also foot and ankle joints so that they will have movements in the joint is supple, and whenever there is a stiffness, that causes secondary pressure areas, and then that leads to pathological callus formation or ulcer formation. So this patient see these cons and callosities. So here this patient is having a con and callosities at the base of the neck of the head of the for second metatarsal, and he is also having a callosities at the PIP joint of the great toe. So these people will have different abnormal biomechanics that lead to the ulcers. So instead of addressing those biomechanics, we start treating these calluses, because you are seeing the bulb and you are not seeing the main switch of your house. That leads to the problem. So once you, instead of addressing the main issue, if you start treating these calluses, starting using these sharp blades, unsterile blades and knives, slowly an ulcer is formed that will never heal. I have seen patients who are having ulcers at the base of the PIP joint of the great toe over a period 10 years, 7 years. So this will become a biggest problem. See what they did here. This is another patient where he has had a callosities at the second and third toe. Instead of addressing the main issue here, they have started cutting the callus with unsterile this thing, and then patient also failed to take care of this foot. He started walking in mud and all that without proper coverage, without proper dressing, so that got infected and he developed sepsis and pus. So most of the common mistake in the diabetic foot is not checking for the vascularity of the leg. So most of the times these people will have vascular issues. They will not have proper flow of the blood supply to the foot, that will leads to the ischemia and harboring of the infection. So when there is no vascularity, that part of the foot doesn't get vascular supply, oxygen supply. So definitely that neck tissue gets necrosed, and that will be the basis for medium for bacterial growth and leading to the sepsis. So in most of the diabetic foods, what we see is circulation up to the ankle. Beyond that, you don't see. Many of us think that there is circulation up to the ankle, so that's fine. But here also see in this angiogram, on the left side, he's having popliteal artery, femoral artery thrombosis, but he has developed some collateral artery, so he's having little bit of supply distally. So this distal supply is saved his limb, but it will not save him from infection, because that supply won't be sufficient for him to cure of his infection. And the right side, see, is having supply up to the ankle joint. But beyond ankle joint, you don't see proper supply. So this is where we commit mistakes. So looking at the supply of blood supply up to the ankle, we think that the infection will be cured because of this supply. But even that is a problem, because we have to go beyond that, look beyond that. So whenever there is ulcer or infection in the foot, we have to see that the blood passes up to the tip of the foot where there is ulcer, where there is infection, so that the infection gets cured and the tissue starts resolving. Another thing is that whenever there is a diabetes, most of the patients don't control their blood sugar. So that will always lead to problems. Control your sugars, control your BP. Otherwise, you will have problem. And these all patients are very high risk patients, because if you have a block in your legs, there will be a block in the heart also. So all these cases are very high risk, and surgeon is putting his reputation to treat these foods. Thank you. Well, oh,